Welcome to Surgical Secrets with Dr. Nair, your front row seat to the world of plastic surgery and biopolymer removal. Thinking about a transformation? Or just curious? Revealing the facts and debunking the myths. Dr. Nair cuts through the noise. Surgical Secrets with Dr. Nair.
Hi, Nair Dolls. Welcome back to another episode of Surgical Secrets with Dr. Nair.
Hey, guys.
Board-certified plastic surgeon here in Miami with his brand new clinic, Nair Miami Plastic Surgery. So today we're going to talk a bit more about Dr. Nair specifically, really get to know him and see how his path of becoming a plastic surgeon was. So, doctor, tell us about it. How did you start med school? What even made you get into it?
So, I always wanted to be a surgeon since I was like a kid. Like everybody wants to do different things, but something about surgery just really appealed to me. I think I saw like a special on like PBS, and it was really something that was interesting to me. So as I started getting older, like I was just always something I wanted to do. So in high school, I did this like program that allowed me to get into med school from high school. So that's kind of how I got into med school
in high school, you're already in medical school.
Yeah. So I did like a 6-year program where you did 2 years of college, and then you do,
So you've always been smart and well.
Yeah, I mean, yeah, relatively, yeah.
And from there, how was college? Like, how was it balancing everything? Because I know myself as a college student, it's not easy.
No.
It's really not.
No, I mean, college was weird. College was the first time where you start to realize, in high school, like you may be the smartest kid there, you do this or whatever, and it's not that big of a deal. But then you go to college and you realize like everybody's kind of smart, So it's kind of one of those things that you just kind of have to like step your level up. So college was the first time I was around like a lot of smart kids, and you start to realize like the way that they identify things, the way that they learn. I never really like group studied in high school. Like I just kind of handled it myself. But in college, you start to work with other people, which is like great.
You get new ideas.
Yeah.
And you learn from them.
Yeah, but it's like kind of dejecting too, because you start to feel like, this guy's a genius. Like, like he just gets it. And I'm sitting there reading. And like, so you start to see there's like levels to the game. And so then you get into med school, and it's even more than that. So then you're like with the top, like, I don't know, 1% to 3% of the country in terms of intelligence. And so you're just like, wow, everybody's really a genius here. Everybody understands it, and everybody has the same passion. So it's harder to fight to get into like the top of the crowd, but it's also like something that you start to like, all right, well, I got to really focus. I really got to figure out what it is I need to do to be able to kind of get through whatever I need to get through. So it forces you to just kind of figure out all the like garbage and like eliminate it from your life to be able to be successful in what you want to do.
What's the main thing that like stuck around you to help you like balance all of that? And at least what's like a tip you could give to other college students out here to help them reach to that level? And any studying tip, anything you did when you were younger, any little small thing?
Yeah, so I mean, I think my answer is like super different now than it was when I was in the situation. So when I was studying and growing up and trying to do that stuff, like I really just, that was all I did. I mean, other than that and like maybe working out, like I really didn't do anything else. I mean, I was one of those guys that, if somebody else, like I was never going to let anybody outwork me. You know what I mean? Like you may be smarter than me, you may be more gifted than me or whatever it is, but you're never going to work harder than me. So like other people would be out, like I'd be studying. I'd wake up early in the morning and I'd write through my notes. I would like memorize things and like that.
So you had a whole schedule.
Yeah, but I mean, I'll tell you this, like the tough part about it now being older is that like I had no balance. I mean, like I didn't do anything other than like study, And like you realize like, I mean, one of the tough things for me was, like I didn't get a lot of experiences. Like if I had to tell somebody about what I did in my 20s and 30s, I mean, I it's not a lot to say. Like I was just working. I mean, working and studying.
You who you are today.
Yeah,
it's all worth it. The sacrifice was worth it.
Yeah, I mean, I think so in some regards, but I mean, like it was like one of those things that like, I'll give you an example. Like I had, when I was a resident in surgery, like, I mean, surgery was my life. Like I thought surgeons were like the best thing in the world. I looked it up to them to like they were gods, like he was just a thing. Like, I remember my attending when I was like an intern, he was telling me a story about his wife gave birth and like he was on call, so he went back, like he got to cut the umbilical cord and then he went back and did 2 cases, and like, a lot of people will hear that story and be like, that's crazy, like that's horrible. But for me, I looked at it, I was like, yeah, man, that guy's awesome, like he's such a badass, and like that is like the kind of work ethic like I idealize. That's what you grow up being like, oh man, these guys were like superhuman. And so I was like, well, I got to work that way. So like, I remember I would be on call, and like, if it was like a busier call, like I got excited, like I wanted to be operating for like 20 hours a day, and then you realize when you get older, you're like, nobody really cares that you operated for 30. I mean, like, if I tell another surgeon that, they'll be like, oh, cool. But I tell it to anybody else and be like, oh, cool. So you miss doing anything real in your life, so that I would tell somebody younger, I would be like, you got to have balance. I mean, I did not have balance growing up, and I do regret that. So I think you have to find a way to schedule the time to do things. Yeah, time management. And I think that was something that I was not good at the beginning, that I'm working. I mean, I'm still working hard to like have that kind of balance, because, I mean, you know what I mean? Like I'll be responding to texts at 3 a.m. You know what I mean? Like I'll wake up to go pee and I'll like respond to texts on the way there because of somebody, or like, I don't trust anybody. So like, I'll call people at like, midnight and be like, hey, I haven't heard from you. Like, are you doing okay? So a lot of that stuff sounds great, but it takes a lot of toll on you personally, where you feel like, it is what your life is. Like, I mean, we're here doing this on a weekend. I'm going to go home, start, like trying to write papers. So you have to find time to recharge as a surgeon, especially because our work is it's never not over. Like there's nobody on call for my patients. Like I'm the only one here. I'm the only one that's paying attention to my patients all the time, trying to make sure everything's okay, trying to make sure there's no complications. If there's a problem, I can do that. But you have to find time to like cultivate personal, like, live your life and enjoy it. Yeah. And I think that is really the key.
But still study.
And for sure. For your
things.
Yeah. I mean, I think that, we've talked about this before. I think the one thing that, I think being a surgeon is very, very difficult. And I think that I tell people all the time, like, if it's your passion, you're never really going to regret it. Yeah, you're going to have ups and you're going to have downs, but you could go at what you would think is an easier path that is, you think is going to make you happier, but you're always going to have that regret. Like, I think the reason for me is like, my life has been difficult, but I don't ever regret, because that's always something I want to do. Like being a surgeon, being in the OR, having a hard case and like getting through it well, or having like, fixing somebody's like really complicated situation, like that to me is a joy that I can't really.
It's that adrenaline.
Yeah, it's like that adrenaline junkie. Like you don't. It can't be described anywhere. Like that feeling that I get, I can't. Like I only feel that like if you're doing something like crazy, and like that passion that people have when they like deliver a great speech, or they're doing a great product. That is passion. And I think that's really the most important thing. So you got to find something. And sometimes it's like stressful, but you got to go for it 100%.
Yeah, it's stressful, especially at a young age. A lot of people don't even know what to do with their life. So it's really good that already from, how old were you when you were like, I want to be a surgeon?
I think I was like 4. So, yeah, I mean, I never really, I wanted to do that.
What show? PBS was it?
This like, it was like a Nova special. It was like this old school thing, where they used to like highlight certain things like in the country. And one of them I think was like talking about like pediatric surgery, about like kids' hearts that are like malformed, and like creating these like new kind of like hearts to allow them to survive. I just thought that was insane. I still think that's just a crazy thing that like humans are able to like create hearts. Like it's just a nuts scenario.
It's nice that you at a young age were already like, wow, I could change someone's life.
Yeah,
like,
it was life. Yeah, it was never. I was like, that's what I want to do. There was never a question. That or being president. That was the only
being
thing.
a president.
Yeah, but I don't want to do that now. But like back then, those are the only 2 things I wanted to do. That was it.
So, what surgeon did you look up to when like during your whole career?
Yeah, that's a good question. when I was a kid, I had something called like pyloric stenosis. So it's a kind of a thing that happens in newborn males where a part of their stomach is too tight. So the outflow of the stomach is too tight. So a lot of times what happens is like you start to feed the kids and they have this projectile vomiting. And so my mom was telling me this story about how like she was terrified. Like my mom came to this country when she was like 17 or something like that, you know? So she didn't know, and she came to like New York City. So she was like, came from like a small part in India.
So you're from New York?
My parents, well, I was born in Ann Arbor, Michigan.
Oh, okay.
So, but they lived in New York for a while before they moved over here. So they were in New York, and you know, my mom didn't really know anything. She was really scared. She like doesn't like medicine, like really scared of like doctors, all that kind of stuff. So like, you know, I was her first kid. I was thrown up. She was like terrified, freaking out. And she'd tell this story about how she went to the hospital and like super scared. And they were like, "Yo, we're gonna have to take your like 2-week-old kid into surgery." So, you know, obviously that's super scary for any parent. I mean, obviously, yeah, being a parent now, like if anyone said my kid has to go to surgery, I'd be like, that's terrifying, you know? Like, and so I can't imagine her being scared. But she was telling me about how the surgeon came in, calmed her down, and like, you know, took her surgery, everything went well, all that kind of stuff. So like that kind of ability to like comfort someone was something that was super appealing to me. So I always wanted to like be that kind of guy. And then I remember like growing up in medicine, like you're like, okay, I'm gonna be a surgeon. And I remember just these guys like they're just like, to me they seemed like superhuman. You know, I remember a story. I was terrified of like messing up in surgery because you don't know how to scrub, you don't know what's sterile, you don't want to screw anything up, and like you think, even though it doesn't really, like you're easy on your med school, you're just putting your hands on a patient, but you're like, I don't want to screw anything up, right? And I remember we were doing a carotid with this surgeon, Dr. Uribe. You know, shout out Dr. Uribe. He was a phenomenal surgeon. But the guy was real old school. So, like, in old school days, which doesn't happen anymore, like, they don't talk to med students. So they're like, you know, they just talk to the fellows, but they feel like, you know, you're not the.
Wow, so the surgeons nowadays don't even talk?
No, I mean, I'm just saying it was like an old school thing.
Yeah.
And I mean, not everybody did that. And he talked to me that day, but it was like my first day on surgery. I wanted to be a surgeon. I wanted to say like, oh, hey, Dr. Ruby, I'm a medical student, but I was so scared. So my fellow was this really nice guy. And he was like, hey, look, just hang out in the corner. After we're done with the case, I'll introduce you to him and you can kind of do that. And we were doing this case and the fellow was doing the case and they happened to like, we were doing a carotid. So the carotid is like one of the main arteries that go to the brain. So if you injure that, I mean, you're literally dead in like seconds. I mean, you bleed out in seconds. So what happened was he was letting the fellow do some of the case. And then what happened was, there was an injury to the carotid. And so like it bleeds fast. So like there's blood all over so he accidentally hits it. There's blood all over the fellow's face and there's blood all over this, the surgeon's face, but he didn't even like blink. I mean, it was crazy. I mean, I know like now maybe like I was like a kid and I'm like making it crazy in my head, but this is how I remember it. Like, he didn't even look at it. I mean, he just took that suture. I couldn't see anything. There was just blood everywhere. Half of the blood is eye. He didn't move. Like, he just sewed it up and it was like quick. Like, she didn't lose like more than like a second of blood. It was like phenomenal. And I remember looking at that guy like, God, you are unreal. Like, he didn't like blood, you know, like if blood goes in your face, like most people go like that, right? But like him, like it just, like it hit him in his, like his eye. He was wearing protection, didn't even bother him. The fellow moved back like that. And he was just like, he took the suture and then you just sewed it up. And it was like done like that. And she didn't miss anything. Perfect, you know, perfect like result. I mean, it was incredible. And I remember being like, God, that guy's got hands, you know, like he's got like, so people like that were just, I don't know, like I was like, I want to be that guy, you know? And like, you know, we would do like heart surgery. Like I went in and I saw, like there was like a kid and they had to do like a replacement on the heart and they had to manipulate this stuff. And like, they're just doing it. Like, it's just, you know, changing your shoes, you know what I mean? Just like something like run of the mill, but they're dealing with like lives. And that was just like, I remember being like, that's what I want to do in life.
Are you still in communication with him? Is he still?
Oh, I wish. I think I'm not sure, but I think someone told me he passed away. I mean, I don't know, but you know, this is like more than 20 years ago. I mean, I don't know what they're doing now, but I mean, these guys were phenomenal. In my head, they were like phenomenal surgeons at that time. I mean, the stuff they did was I mean, it really shaped what you wanted to do in life.
Of course.
Yeah.
So you did mention about growing up in Michigan, right? How was that? Tell us about it.
Yeah, so I was born in Michigan, so my dad was working at the University of Michigan at that time. So it was great. I mean, I really had like I think a lot of also what wanted me to go into surgery is like my dad worked really, really hard, worked long hours, so he's working at the
He
hospital.
was also a role model of yours.
Yeah, for sure, for sure. And I
Yes.
mean, I always thought he was like the smartest guy when I was a
Yeah.
kid. So like I just wanted to hang out with him. Like my mom quit her job when I was born, so she like took care of me and my brother. So we kind
Mhm.
of spent a lot of time like just hanging out with my mom, and then when my dad would come home, we would hang out. But I always wanted to like spend time with my dad. We grew up like playing like tennis and stuff like that together. But like he would help me like I remember him helping me with like homework and doing science fair projects and stuff like that. But he was a big role model in my life. Like I wanted to I wanted to be like him. I wanted to be as smart as him and all that kind of stuff. So
Did he have anything to do with surgery? Like, is he?
no, no, he actually wanted me to do cardiology because I think he has this same kind of thing that I kind of feel right now. Like my dad worked a lot of, really, really long hours. And I think, I mean, he would never say that kind of stuff to me, but like, I feel like he has some sort of regret about not being around him more.
Mhm.
And so he wanted me to go to like some sort of like an easier specialty. Like he wanted me to do medicine and do cardiology, but my mom was like, nah, do surgery. If that's what you want to do, do surgery.
Exactly.
But my dad was like, don't get in a field where like it's so stressful and it'll work out because the residencies are like very, very different. Like surgical residency was tough. I mean, it was really, really, it was really
How
hard.
come?
It's just very demanding. I mean, you have to like you have to the thing about like surgery versus medicine, I mean, and
Mhm.
I'm not saying one's better than the other. Obviously I'm biased. I think surgeries are better, but
Mhm.
not only do you have to understand the non hands-on part of medicine,
Mhm.
but you have to like develop technical skills because I mean, if your hands aren't good, I mean, you can be a great surgeon, but you're not going to be able to deliver good results. And
Mhm.
every person is different, every anatomy is different. Every time you're doing surgery, like you're kind of taking everybody's life into your own hands. I mean, it's a very um solo mission, like you're just by yourself doing everything. So that level of intensity is then factored into the training. Like they like right off the bat, like when we were interns, like we would used to have this thing, like, my very first call, like you're in charge of like taking care of an entire hospital. And I feel like me and my buddy, like we were like on the call at like two hospitals. So I was on call at one hospital, he was on call for the entire hospital, all the surgical patients. So it was like terrifying. And so like, your chief resident will come in and be like, hey, I'm here if you need me, but don't need me, which basically is like, don't call me unless like something really is going. So like
Emergency.
you really like you're like you put the pressure on right off the bat to figure it out, and it's kind of like a or sink or swim kind of a mentality, which it's a very different training now, 100%. But
Mhm.
back then I like that because
It
it
builds your character.
yeah
It makes you who you are
it
today.
pushes
It
you.
pushes you.
Yeah. I mean, like I was terrified like my entire like first 2 years. I feel like I didn't start feeling like confident until my second year, but like your first year you're just like, "Oh god, I don't want to hurt anyone. I don't want to hurt anyone." And like you have to like deliver good results. You have to practice. Like I remember I used to like have like all these sutures on my leg, and like as I would be studying I would just be practicing like throwing knots, because you just wanted to be the best, because if any time your attending asked you to throw a knot, you didn't want to be slow, you didn't want to
Yeah.
you know what I mean. So anytime an attending let you do anything, it was like a big deal, so you didn't want to like be ill prepared. I would sit there before cases like trying to memorize every step of the case, and because it would be like, what comes after this, what comes after this case, and that level of like training and that aggressiveness towards making sure you were good, like I missed that, and I'm glad I trained that way. I know a lot of people feel like that was like a malignant type of training,
Mhm.
which I mean obviously it's weird because now I'm also helping to train residents, and I don't ever want to be malignant or disrespectful or hurt anybody's feelings, but I do appreciate the way people were like that with me, because I appreciate how it pushed me. Like I remember like
I
if
feel
I
like everyone needs that though. Like you
yeah.
can't be too soft and too baby like with with teaching people. Or
Yeah.
they're never gonna learn, or they're never gonna be the best.
Yeah, but I think just times have changed. I mean, you can't be
But
yelling
there's
at
also a
people.
balance, exactly.
Yeah.
There's a balance.
Yeah.
You can't be disrespectful.
No.
You can't be yelling.
No.
But for sure, like,
Yeah.
get on your
Yeah.
you know?
Yeah, for sure. Yeah. I mean, I'm just saying, like, I don't know how aggressive training is nowadays. I mean, I know that it's definitely must low key, but I remember when I was being trained, the level of excellence that was expected of me was like, it had to be there or it was a problem. Like, they would not
So that's a lot
let
of
you.
pressure.
It was a lot of pressure. I mean, like, I remember like crying in the elevators because like I felt bad. I remember we'd be like performing M&Ms. Like, you would have to, like, you know, we used to do this thing where M&Ms are morbidity and mortality. So if something bad happened to a patient, or God forbid somebody passed away, you as a resident who was on that case would have to present it. Even though, you know, you didn't do the case or anything like that, like, you would present it as if you did that entire case. So you would present it in front of all your residents and all the faculty. And I remember, like, they would come at you. Like, they would be, well, why did you do that? Like, you know, like you did the case, and you'd be like, I didn't do anything. I just sat there, you know, I'd be like, well, what would you do differently? And like, they pushed you to know how in that moment to fix what you needed to fix. And it was really stressful. I mean, I remember like times where like I would see residents just getting the crap kicked out of them. And like, you don't want to look at them because, you know, they're your colleagues. You don't want them to be like, you know, it's hard to look at somebody getting, you know, beat down on, you know, so everybody's looking down at their phones, and, you know, nobody wants to like it. And so like they would call on you because if they didn't know, they'd be like, hey, you know, Dr. Nair, you know, what would you do for this, blah, blah, blah. And so you would have to know the answer. And it was super stressful, super like anxiety, but it's necessary in my opinion.
Is there anything that you told yourself to, like, crying on the elevator? Like, is there anything?
No, I mean, I remember like I had an M&M, and I remember they were coming down on me because, you know, it was a AAA, which is like an aneurysm in the abdomen. And, you know, somebody was bleeding, and, you know, we fixed the aneurysm, but they still bled out. And they passed away, you know? And so they were like coming at me like, well, why didn't you do this? Why wouldn't you have done this? What could you have done differently? Should you have opened, you know, all that kind of stuff, which, you know, like, you as a young kid, you don't, I mean, you're like, I don't know.
How old were you?
I was like a second year in training. I was like such a junior resident, you know? And like, you know, you did everything, you did all the stuff that you needed to do, and, you know, all that kind of stuff, but you feel bad. Like, you feel like, "God, should I have done different something? Is there anything I could have done?" But, you know, everything was done correctly. It's just sometimes bad things happen. Like, like if someone comes in half dead, you know, like, I mean, there's not much else you can do. You do your best you can.
There's always a chance.
Yeah, of course. I mean, like, you know, a person came in like with like you opened up the abdomen and there was just blood everywhere. You know what I mean? And if they're abdominally, I mean, like, there's nothing to do. I mean, you know, really, you do your best, obviously, but as a kid, you don't know that. So you just take everything personally. So everything that you go wrong, you think it's my fault. I should have messed up. I didn't do anything right. I should have done this. So you start to feel like, you know, and the attendings, they know that. They know, like, at the end of the day, they know, hey, look, there's nothing you could have done. It was done the right way. But they want to push you because they want you to, like, have that understanding of, look, sometimes things happen that are just out of your control. Yes, we all do the best job we can, but, you know, life is life. You know, sometimes unfortunate things happen. You do the best you can, you know, but they push you because they want you to be hypercritical of yourself so that you think to yourself, is there anything I could have done different? Is there,
yeah, little details.
And focus on the little details. Because even if there was nothing you could do different, you think about it differently. You think, well, maybe I can do this differently. Maybe I can kind of do that. So it pushes the field forward by pushing everybody in that field to just be better and accept no, like, problems. But like, I remember as a kid, you don't know that. So I remember like crying in the elevator thinking like, I should have done this, I should have done that. But they don't care. I mean, it's not like okay, you know, go home, Dr. Nair, you know, no, but you round. So like, you know, I cried and then I just like wiped my tears, like, you know, took 2 seconds and then went and rounded on my patients, you know, and like made sure the rest of the day was okay, operated and did fine. And like, that was that in itself is a lesson. I mean, like there are days when you have, you're tired, or you just had a bad day at home, or, you got in a fight with somebody, or you just don't feel like it, or, you had a bad outcome, but you have to be able to separate that and then move forward. And I think with surgeons, that come like second nature to us. I mean, a lot of people will ask us like, questions. I'll be like, hey, are you tired, or it's like this? And like, yeah, I may be tired, but that tired is different. Like my tired, when I'm in the operating room, I don't feel it. Like people say this all the time. Like, what if you have to pee during surgery? I don't, when I'm operating, the only thing I think about is like surgery. Like I could have to pee so bad, but if I'm in surgery, I don't feel it. I don't feel nothing. Like the only thing I'm thinking about is my technique, what I can do better, what the next step of the procedure is, how to avoid issues, make sure my anesthesiologist is looking at it. Like I don't think of anything that's non-surgical. And then after surgery, yeah, then like that feeling will come back and I got to go pee. But like I'm not tired. I'm not nothing. I mean,
Would you say that's you, or that's how most surgeons
I
are?
think that's how most surgeons are. I mean, I don't know of a surgeon who's like, oh, I have to go pee and like is in the middle of a case and leaves. I mean, that's just crazy.
Yeah.
I mean, like we're just like, we're trained that way. I think that our bodies like figure it out. I mean, it's just something that you, years and years of training, you train yourself to do. But I think the other thing is like, as we get older and a lot of my generation starts getting into like older, being like, the middle of the road surgeons kind of stuff, middle-aged surgeon stuff, we start to feel like the way, I think we need to do a better job of supporting each other. And I think that we're so geared on being hypercritical of ourselves, that feeling like I should do better, I'm the one who caused the problem. Like we don't give each other like a break. Like there was a really great article about like depression among surgeons.
Is
like
that common?
Yeah, very common. I mean, and I think it's because, surgeons are it's a very lonely field. I mean, you're not, I don't get to operate with my buddies. I don't get to like spend time, like it's not a communal really environment. Like I see my patients and I get to hang out with people. I do content with you and stuff like that. But at the end of the day, I'm in the operating by myself. You know what I mean? Like I'm doing by myself. No one's like, hey, nice job, Dr. Nair. You know what I mean? Like, I mean, other than, so it's a very lonely specialty. And I think we need to do a better job of like appreciating other surgeons. Cause like I'll see
the community.
Yeah.
It's bad.
I don't feel like,
toxic.
I feel like it is. I mean, I feel like we could do better. Like I see other surgeons work and I'm like, man, I go out of my way to like compliment them and, be like, that's a great job, man. You did a really phenomenal work. And like, being all the residents that I trained with, like we're all in a group and like, we'll like, if he'll have questions, we'll ask him. And like, we go out of our way to really compliment each other. And I think that's like, I wish that was more prevalent in our community, but I think as surgeons, we're just hardwired to be like, alone. And I think that kind of sucks. I mean, I think that it's a lonely field, but it is what it is.
I have a question for you.
Yeah.
And I feel like all the Nair dolls would want to know. What was your first surgery performed ever? The first time you laid
my first solo surgery?
Correct.
Oh man, I gotta remember. I think it was. I think it was. There was a kid who had a supernumerary digit. So he was born with like an extra finger. So it was like causing problems with the kid, and it wasn't getting good blood circulation. So I think it was removing that.
And how was the experience?
I mean,
Were you nervous or already with all that practice?
For sure. I mean, your first surgery you do alone, you're nervous. I mean, if you're not nervous, I think
something's wrong.
You're crazy. Yeah. I mean, I was terrified. I mean, I didn't show it. I don't think anybody knew, but in my head, I was like, oh God, don't screw this up. Don't screw. I mean, it's a relatively easy surgery. It's not something like complicated, but yeah, you're just terrified because it's the first thing you're doing by yourself. But I think the way that made me feel comfortable is you just trust your training, like I don't feel like my training was bad at all. I'm super confident with the way I was trained.
What school? Like, what's the name of the school that you went to for the training and all that?
Oh, a lot of. So I went to Jefferson Medical School for my medical school. Then I went to Cleveland Clinic for my general surgery. Then I went to Chattanooga for my plastic surgery. Then I did an aesthetics fellowship in Laguna Beach. And then I did a craniofacial and pediatric fellowship in Milwaukee. Medical College of Wisconsin. So like I was trained for 10 years before I did a solo surgery. So
so yeah, you're good.
yeah, I mean,
You're
yeah, you
nervous,
think so, but
yeah.
you just think to
You have
yourself
10
like,
years of training.
yeah, you think to yourself like, do I know what I'm doing? What
Mhm.
are all the steps? If there's a problem, how do I fix it? Like you go through all that in your head. I mean, the night before I was reviewing, anatomy stuff, so like stuff like that. But yeah, it
Was
was
it here
nerve
in
wracking.
Miami?
No, it was in California.
In California.
Yeah,
So the California is where you started.
yes, I started in
So
California.
from Michigan, you went to California, or?
No, 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 all over the place. So from Michigan when I was that was when I was a kid. So then my parents moved to Buffalo. So I grew up like probably the majority of my life is in Buffalo, and then from there I went to college in Penn State, and then I went to Philadelphia for med school. Then I went to Michigan for like the first 3 years of my general surgery training, and then I transferred out here to Cleveland Clinic in Florida. Then I went to um, Tennessee for my plastic surgery. Then I went to Laguna Beach, California for my aesthetics. Then I went to Milwaukee, Wisconsin for my craniofacial. Then I went back to California for a couple years of my training. And then my dad had um, like heart trouble. So he was having some problems with his heart. And my brother also lives in California, but his in-laws all live in San Francisco. And so like my family lived here in Miami. So, we had no one to take care of my dad and he needed open heart surgery. So I like shut down my practice in like 30 days and then moved down here to Miami.
And how was all that moving around?
You
Did
know-
that not affect you? Like you?
You know what? It is. I feel like people like look at it negatively. I think that what I lost out is like you don't have like long-term relationships with people because obviously it's hard to like develop that when you're only in places for like 1 to 2 or 3 years. But I mean, I liked it. I mean, I think the good part about it is like you just feel like you can go anywhere and like make friends. Like I don't have like a fear of public speaking at all. I don't have a fear of like meeting new
I feel
people.
like that's why people love you so much.
Yeah.
'Cause your personality is just you're so
Yeah.
talkative, you're funny,
Yeah.
all of that.
Yeah, I mean, I feel like I can make friends with anybody like
Yeah.
right off the bat, So
So
that's not something that it was, but the tough part is like, you want to like spend time with a lot of people, so you don't get that like years and years and years of like, oh, remember when we used to do this back in the day? Like you don't have that because you haven't spent time in a place, and it's also hard to like put your roots down if you're constantly moving. But I mean, I liked it. I feel like you just see all kinds of different things. I mean, I've been on every coast,
was it your choice to move on all those locations, or like you could have just stayed in Michigan your whole years to study?
No. So that's a good question too. Yeah. So the way that it works is, so I was able to choose to go to Pennsylvania. I was able to choose to go to my medical school. But after that, you go into something that's called a match. So the way that works is you interview at a bunch of places. So for my general surgery training, I interviewed at like, I don't remember, I think 13 or 14 places. And then you put them on a rank of like, where you want to go from like, let's say 1 to 14. Okay. And then every place that you interview at, they rank the candidates. So they rank them on a scale of, 1 to however many people they operate, like they rank. So let's say 1 to 40. And then they try to match them as closely as possible. So you can put where you want to be, but it's not necessarily where you're going to get. So like
so
that's
they choose the school for you basically.
yeah, it's like a weird algorithm that
Okay.
I know there's some like proprietary information. I don't know what the algorithm is, but like, yeah, it's called a match process. So it's a little stressful because, let's say like you have family in California and you specifically want to go to California, it's hard, it's because there's a lot of people there and all that kind of stuff. So yeah, it's called a match system.
And how is to become a board certified plastic surgeon?
It's a lot of work.
It's more.
Yeah. So, I mean, I think we talk about this all the time, but board certification is, it should be looked at as like the minimum standard of excellence. So what we do to become board certified is like an exhaustive, step. So on top of all the training that you hear about that we did, you have to then take a highly competitive written exam. And based on that written exam, you have to pass it. So it just depends on the year, how many people they fail and all that kind of stuff, what the numbers are. But after that exam, if you pass it, then you have to take a oral exam. And an oral exam is, so you sit in a room with, a couple attendings that have been vetted throughout, time and through, American board, and they ask you questions based on like imaginary patients and your own patients, and they deem whether or not you were safe, whether or not what you did was appropriate. And so like it's an exhaustive exam. And then even after that, like you still have to take exams, every year. You have to do certain things to show the
To this
board.
day, or
Yeah, like I just took an exam. I think I took it in May or something like that, or April, and like you have to pass that exam and you have to do that. So like it's still a very thing that you have to do every year that allows everyone to make sure that everybody has some standard that they're following, and they're still continuing
so
to
the people who
stay up on
aren't board
things.
certified plastic surgeons don't take these tests, so they don't have nobody monitoring them,
Uh,
basically.
yeah, I don't know. I mean, yeah. So
Okay.
the difference is that the American Board of Plastic Surgeons is it is part of what we call the ABMS, which is the American Board of Medical Specialties. So they are vetted through years and years and years of training, testing, scrutiny, all that kind of stuff. So other boards, boards, they're not in that specialty group. So, they don't have the same level of scrutiny that we may have. So I can't speak to what they do or do not do because I don't know. I just know that the level of training and stuff that we do is, pretty extensive. So for us to be, saying that you're a board certified plastic surgeon, at least for us, it's a thing of pride because, we went through a lot to get here. I mean, it's not easy. I mean, like I look at another board certified plastic surgeon and I look at them with respect
Yeah.
because I know what they did to get here because I had to do it. So, I mean, I look at them like, oh yeah, they know what they're doing. So, I mean, you are never going to see me disparage a board certified plastic surgeon. I mean, unless they, did something
How
insane.
come most, like a lot of surgeons aren't board certified plastic surgeons?
Um, you know, it can be because, they wanted to take an easier route. Nobody
Hmm.
wants to do that level of training. Nobody wants to do that level of um, spend all that time because I mean, you think about it, I mean, I trained for 10 years. I mean, there are not a lot of people in the country who can say they trained for 10 years
Yeah.
because most people are like that's
So
insanely
much.
long. I
Yeah.
mean, it's a decade where you're making not a lot of money, you're not spending time with your family, you're just working, like you said, you're traveling from state to state, so nobody's really going to sit there and be like, yeah, I'm going to do that. So they feel like they can do another route or they can do it depending on the laws of the country or the laws of your state. You may be able to do what I do, um, but in a cheaper and easier, faster kind of thing. But it just doesn't mean that you have the qualifications to do it. It just means that you can do it. So
Hmm.
I think that for me, when I look at board certification, it doesn't mean necessarily that you know how to do the technique well. I mean, obviously it
Yeah.
does, but it also means that God forbid something happens, you know how to fix it. You're the guy they come to when somebody
God
else screwed
forbid
up.
something happens, as
Yeah.
in what way? Like,
Like, complications happen all the time. So like
mhm.
let's say there's a problem with, like we did the other day, like somebody did an arm lift and couldn't close it,
He
So
wasn't a board certified plastic surgeon.
no, I mean, I
Okay.
I don't know what he was or was not, but I'm just saying, like, it can happen. Like, you don't
Hmm.
know how to do an arm lift properly, or you just do a different technique, or you messed up or something. And they may not know how to fix it, but I know how to fix it. I can rotate flaps in that way. I can do it, so I was
It's
able to
that
take
arm
care of
lift
it.
that's posted on Instagram, right?
Yeah, yeah, that one.
Yeah.
Yeah. So like, I know how to fix it. I know how to, do what needs to get done to kind of get that lady to have a closure. So
Mhm.
that to me is what board certification means. Like I have that training, I have that confidence to be able to deliver a good result.
Of course.
Yeah.
So, can plastic surgeons also give patients biopolymers
No,
or any like
I mean, I guess technically they
defects like
could, but
that?
no. I mean, no board certified plastic surgeon is doing that because I mean,
No, like just plastic surgeon.
yeah, I mean, I guess they could. I
Uh-huh.
mean, I don't, I would hope that they wouldn't, but yeah, anybody with the training that we have, they don't do it. But yeah, technically anybody can do it. You just have to get the material. But I mean, none of us are getting
But
that kind
why
of
would
material.
people do that?
I mean, a lot of it is people just don't know. I mean,
Not even the surgeons.
no, I mean, I think the surgeons know, but I think
They didn't know the outcome of it, what it was going to be.
I don't know. I mean, I guess if you want to like give them the benefit of the doubt, I think they don't. Yeah, I don't think they realize how bad it could be. I mean, that's me being generous. On the evil side of it, I guess.
Money.
Yeah, you would think it's, oh well, I know this is going to be, but I can charge them to do it, and that's what it is. But I mean, I know that's all speculation. I'm not exactly sure, but
How was about polymer removal training? How was all of that? Because you're one of the only 3 surgeons who does it.
yeah. So I mean, to be honest, it's like training on the go. So there is very few surgeons in the country that do it, and none
Like
of
how
the
many exactly?
I don't know. I mean, the ones that do it a lot, I would say there's probably like 3 or 4 of us. There may be some surgeons that do it once in a while, but I don't know of them very well. I just know of the three of us that do it probably in a more like common fashion. Like pretty much it takes a
You
majority
take
of our
it,
practice.
yeah, and you do it like almost every day.
Yeah. I mean, it's probably like majority of my practice is probably doing stuff like that. But yeah, the training for it is like non-existent. I mean, that's kind of why I wanted to work with the American Society of Plastic Surgeons to try and generate a situation where we can train people to do that. Because I mean, it just depends on your exposure. Like, I mean, if you have a training program in the middle of Kentucky, I don't think they're getting a lot of biopolymer work there. So it doesn't really make, it's going to be hard for them to get the patients to be able to do that, right? So you really think of it, it's really only happening in major cities like New York, Miami, or LA. So similarly, that's where the majority of us are that do that kind of work. So I think it's better to like have a community where we have at the big meetings where we can kind of teach people who don't do it a lot but see it once in a while, so at least they have that confidence to be like, yeah, maybe I don't see it all the time, but I feel like I can handle this kind of
So
thing.
you're teaching people how to do it?
I want to, but I mean, there was there wasn't that much interest. So it was kind of dropped, but I'm still trying to work with the leadership to trying to generate a situation where we can try and teach other surgeons how to do it.
Nice.
Yeah.
So biopolymers, can you explain what that even is? I don't know what that is.
Sure. Yeah. So biopolymers is just like a catch-all term. It really just describes silicone. It could be methyl methacrylate, cement. It could be oil. A lot of times, it's just really anything foreign that somebody has injected to augment your area. So it can be injected into the buttocks. It can be injected into the thighs, the hips, the lips, the face, the breasts. Those are the most common places that you see them getting injected.
So the surgeons knew what they were doing. If you're injecting
Yeah.
cement,
Yeah, I mean, if you're injecting cement, yeah, I mean, you should know what you're doing. But I mean, the only time I've really seen those is in like foreign countries. So I've had people that have come from like Peru or something like that. Yeah, I don't see a lot of that here in the United States, but I mean, that doesn't mean it can't happen. But yeah.
But nowadays it's not coming out as much, right?
No,
No.
I don't think
Because I got my lips done not that long ago.
Mhm.
I didn't even make sure if it was a board certified plastic. I fell in the same footsteps as a biopolymer patient. I don't think I got biopolymers on my lips, but the fact that I didn't even check if it was a board certified plastic surgeon, I didn't even check what they had on, like what they even injected inside of me. So what's an advice you could give to not only me but our near dogs watching to avoid that, because that
Yeah.
was a really big mistake of mine.
Yeah, it's a good question.
Yeah.
So, there's multiple ways you can check on someone's board certification. I think one of the easiest ways is if they don't advertise themselves as being a board certified plastic surgeon.
They're
So it has to date. They're not, because I mean that's one of the laws that we have for ASPS, and really for state to state. I mean, you can't say something that you're not. So they'll find clever ways around it. So they'll say that I'm a plastic surgeon, or they'll say I'm a board certified cosmetic surgeon, or they'll say I'm a board certified surgeon. So what that means is, unfortunately, it puts the onus on the patient to figure out, what does that mean? You know what I mean? Like, you're a board certified physician in what? Are you board certified in medicine? Are you board certified in dermatology? Are you a board certified orthopedic surgeon? Are you board certified, general surgeon? Like, are you have you done plastic surgery training? So the best way to do that is you can just go to the American Board of Plastic Surgeons website and look. You could go to ABMS or Certification Matters, look at them and try and identify what board is your surgeon certified by, and that's the easiest way to tell you. Secondly, when you're getting things injected, always you should be very upfront about it. And that's I mean, I think that's maybe a more personality thing, but it's also the way we are trained. I mean, when I'm doing Botox or I'm doing fillers, I show my patients the Botox
Yeah, you
vials.
didn't show me anything.
Yeah.
For instance, I don't know, like what the like even if he told me a specific, oh, this is what I'm gonna use inside of you, I'm not even gonna know what that is.
And that's true. That's true. And so, yeah, and you're right. And even then, you're right, I could show you anything, you'd be
I wouldn't
concerned.
know, and I would just be like, okay,
Sure. But I mean, at least that's something that you want to do. Like for
yeah,
me,
of
like you
course.
want to show them the bottle, you want to show the expiration date, you want to show what it is. But the other thing is, these things come boxed. They're not like free floating gels or anything like that. So someone's like taking up in a bottle, like that's not really appropriate. Like, and it has to be like identified. Like you really want to get stuff done in a place where you can trust, because like you said, at the end of the day, you can do as much as you can to identify if a surgeon's board certified and if what they're doing is appropriate, but there's a level of trust that you're giving somebody that you just can't figure out everything about it, right? I mean, it's just impossible, and it's just kind of life. So the best way to do it is follow the surgeon a lot, identify his or her like personality traits that you trust, anything that they do. Try and be aggressive about, hey, what do you inject? What is it? Oh, let me look it up and see what that is. That
So
kind
do
of
your
things.
the research
Yeah,
yourself.
I mean, unfortunately,
Because
that's
obviously, if they're injecting biopolymers, you're not gonna be like, oh look, I'm
right.
injecting
Yeah, here it
silicone.
is. Yeah, they're
So
gonna.
you need to take the extra
Yeah.
step.
Yeah, and a lot of times they'll just kind of like try to sweep things under the rugs. Like if you're doing something kind of like injecting something kind of illegal or just not kosher, then you're not going to be real upfront about it. You're going to be
Mhm.
kind of like, "Oh yeah, yeah, no, it's just, it's this or
So
it's,
if
it's vitamin C or it's
yeah.
hydrogel or it's just, it's this or that and whatever." And so when people are uncomfortable being really honest, I think that to me is a red flag,
Mhm.
like I love it when patients ask me, "Hey, what could go wrong in surgery?" Because I want them to know that. I don't want them to be like, "Oh, well, I think this is going to be whatever, whatever, whatever." I think that level of honesty, it helps like a more honest discourse, which makes it more likely that you're going to have a successful relationship with this person. So,
Mhm.
I think it's really important being upfront.
Yeah. Um. Yeah, I'm scared. I don't think like if I were to, how would I know if it's biopolymers though? Like, what are some signs? Not that I have it, but
Yeah, I
I
don't, I
haven't
think you
checked.
might be good, but I mean,
Because it's not
sometimes.
really common nowadays. That's why I asked if it's common. Because I got it done not that long ago. So it's,
Yeah, I don't think it is. I mean,
yeah.
it still happens, but it's
Yeah.
not, I would say, common. But yeah, it was more common like about 12 years ago. It just doesn't.
Hmm.
I mean, it's unlikely that at a med spa these days you would have issues like that. But you'll start to feel lumps. You'll start to have some pain. You'll notice.
Doesn't it get bigger than usual?
Yeah, it can get bigger. It can grow. It just depends on on the patient, but yeah, you'll probably know. But again, the best way to do that is just identify what you had
Hmm.
injected.
So biopolymers only come from like things you inject. Like you can't get biopolymers from a BBL,
No, no, no,
lipo.
no. It just
Some
comes from something that somebody else has injected into you.
okay. So
Yes,
like um butt shots,
yes,
lips.
yes.
When I do like the liquid rhinoplasties.
No, I mean, liquid rhinoplasty is just somebody using filler. So I mean, you can do it with biopolymers. I think that's a stupid idea, and I don't think that's very
Hmm.
commonly done. So I mean, technically you could do that, but liquid rhinoplasty is a technique. It's not like a product. You get what I'm
Okay.
saying? So
Yeah.
it's not like every liquid rhinoplasty is biopolymer. That's not true. It's most of
It
the time it's
could
filler.
be.
It could be if the
Okay.
person injected, but I don't. Again, I don't think that's really common.
Yeah, because it won't even give you the results. Or
It may or may not. I mean, it's just not. It's not very common, I guess.
mhm.
Most people that are doing that, like they're higher level injectors, and higher level injectors are not using garbage. Like they're using good material.
And for liquid BBL.
Same thing with liquid BBL. Yeah, I mean, guys that do it, like every time I'm doing it, I'm using
Mhm.
filler. Like I'm not using something permanent. Oh, the other good thing is if somebody says the word permanent to you when they're injecting, that's a big red flag right there. Because
Nothing you inject is
nothing
permanent.
that I
You know,
inject.
I didn't know that. I
Yes.
thought like when you get your lips done or Botox, it stays for you forever.
No.
I did not know
No.
that.
If
That's like
anybody's
you gotta need to get retouched every 6 months, every
correct.
year.
Yeah. So that's a big red flag. So when I inject something, I tell them all the time, hey, this is going to look great for like 2 years, 2 to 3 years, but it might start to, get lower in 3 years.
Unless it's an implant.
Correct. Unless it's an implant. Yeah.
And
but
do they have lip implants?
they do. I don't like them, but yeah, they
Yeah,
do make
that
them. It's
sounds
not very common in
that
the United
sounds weird.
States. Yeah, it's not a good idea.
Yeah.
Yeah. But yeah, if somebody says permanent,
Mhm.
then that's a red flag that it's probably not something that you want to get injected.
Mm.
Yeah.
So before we end this, I have a question. Um, already going like I know it was always your passion since you're like 4 years old to become a plastic surgeon, but already going this far in the field with your passion, how do you stay so consistent? How did you really? That's a lot of sacrifice. That's a lot of what kept you going.
I think it's just a dedication to the
Mhm.
discipline. I think that um I take a lot of pride in my work. I take a lot of pride in putting my name on somebody's body. Obviously
Mhm.
not literally, but like I just want to be the best at what I do, and I want to deliver like good and safe results. So I'm always like reading, I'm always criticizing my own work to see what I could have done differently, what I can do better. I'm always like pushing the boundaries of um how can I make this look better on somebody? How can I deliver a safer result? What I can do to create a scenario that somebody feeling bad about themselves or somebody that has a problem, it can get fixed. And I think a lot of times, it weighs down on you a lot. Like I feel the pressure that I put on myself, but there will be times that recharges me, such as seeing my kids and like hanging out with them, or like when you do something for a patient, and sometimes they'll cry and give you a hug and they'll say like thank you, like it's not significant, but that little thing makes me feel like what I'm doing is important and what I'm doing has made a difference in somebody's life. And I think oftentimes I have felt very lonely and I have felt very like by myself. And I felt like I wanted somebody to reach out and like make a difference in my life. And I may have not gotten it, or I may have gotten it. It's been very significant to me. And the idea of being able to touch somebody else's life in a positive way and have it be meaningful to them is important to me, because I think at the end of the day, it's hard. You feel like you're a number. You feel like,
Mhm.
what is so special about me? What is so significant about me? What is something that I bring to the table that maybe somebody else can't? But when you make that difference in somebody else's life in that moment, in that like microcosm, like that's something that has helped them out of a situation that maybe somebody else couldn't have.
Mhm.
And to me, I think that at the end of my life, I want to like sit down and think about moments where I helped somebody out and how that made me feel and how that made them feel. Like I think to me that is what's important to me. That's what makes my life going to be significant. It's not any monetary amount or like any accolade or anything like that, but I am going to remember patients that were like, thank you for doing what you did. It made me feel so much better about myself. It made me like, I was having a really rough time. I couldn't sit down, and now I can sit and play with my kids. That to me is very meaningful. So
Yeah.
I think that's what keeps me going on like the bad days, and that's what definitely makes a difference to me on the good days.
Of course. So it's your passion and plus the little things that come with it.
Yeah, I think it is. I mean, I tell everybody all the time, I think surgery is a passion,
Mhm.
and if you aren't passionate, and I think that goes for anything in life. I mean, if you're not passionate about what you do, you got to be doing something else, because it's just probably not worth the time
Yeah.
and stress that it takes in your
It's
life.
something that you're doing every day.
Yeah.
You
Yeah.
gotta make sure you like it, because
Yeah,
if
for
not,
sure.
Well, thank you so much, Dr. Nair. So, Nerdas, remember if you have any questions, if you have any concerns, to call 305-488-5707 and also to DM us at Nair Mammy Plastic Surgery as we do post tips, health tips, and things that you should know for your upcoming surgeries. And you could also DM us to communicate with Dr. Nair. Stay tuned for more episodes of Surgical Secrets of Dr. Nair.
Thanks for tuning in, guys.